Hello and welcome to NewsClick. Today, we are joined once again by Dr. Yogesh Jain from the Jain Swasthya Sahyog, a community NGO in Chhattisgarh which focuses on health. And we are going to talk about the COVID-19 situation in India, especially over the past 1 week. Thank you so much, Dr. Yogesh, for joining us. So, we spoke on Tuesday. We are entering the seventh day of the lockdown. We spoke last Tuesday when things were just getting into the country was just slowly about to go into lockdown mode. And a lot of concerns have been raised since then. The number of cases is now, of course, soared to over 1,200. The deaths have gone up to, beyond 40. Of course, the situation is still not as bad as some of the countries in the West. But first of all, how would you evaluate the lockdown that has happened over the past 1 week, especially in terms of how much it might be able to stop the spread of the disease?
Yeah, so this is the seventh day of us, all of us being locked up by the state in our houses, and but that was the attempt at least, and the idea was to decrease to cluster people in their own homes so that they don't mix with the larger groups of people outside their own immediate communities, which did not happen, frankly, because what we have witnessed in the last 7 days has been a mass migration and a mass movement of people from urban areas to the rural areas where they came from in the first place. And it's anyone's guess that at least 5% of the country moved, in fact. To a different place from where they were before this lockdown happened. So the hope that any amount of preventing people from moving around and remaining to where they are with their own viruses and their epidemiology would remain static has not happened, and I think it is unlikely that I feel that the lockdown would have effect rather than, in fact, the virus, which is clearly smarter than all of us, including our state, is likely to make further inroads, and we can enjoy and bask in the comfort that we are slightly behind on the curve, as it were, compared to other countries. But even the last few days' data suggests that the numbers are increasing in at least 4 different states of the country, and we're not doing as well also in terms of the number of deaths that have happened for the number of people tested and found to be diseased. But at the same time, I don't see a great amount of effort being made into putting up public health systems in place, which was the maximum hope that was happening from the lockdown, that we would use this time to set up some systems of testing, isolating, treating, and developing systems to combat the further onslaught of this virus. It was no one's case that we would prevent this virus from coming us and hitting us, all of us. It is only to buy time so that it hit us in a little more protracted fashion rather than all of it at the same time, all of it immediately. And I don't see any efforts at my own province level in Chhattisgarh or at the national level, which is worth talking about in terms of developing the public systems that we should have. And I would say that it's best evidenced by the number of tests that we still do.
Right.
Much as there is some amount of noise being made that we are increasing the testing criteria and we would be doing a larger number of tests in the next weeks, but this week that we are finishing today of the lockdown hasn't witnessed a great increase in the number of tests being done.
Right. So the other key question along with testing from the very beginning was the question of how prepared our public health is. You already talked about it. But also the nitty-gritty of personal protection equipment and the kind of, say, resources that are being provided to doctors, to nurses, to healthcare workers who are on the front lines of fighting against, like the Prime Minister himself has said, front lines of fighting against this disease. So, do you see any major effort or initiative happening in that area as of now?
So, starting from 27th of February, when this call was taken on developing a rapid program to combat the epidemic, even the first 3.5 weeks, we did not see any movement about, procuring the personal protective equipment for the people of the who will be at the front lines to handle the problems. But on the contrary, even in the weeks that have happened in the last 10 days also, it has been treated more as a logistics issue, as if that one has to get the protective equipment as much as arranging ambulances or arranging certain pathways in care in a hospital. Well, I would say that the availability of personal protective equipment is more related to the outcomes. As I can see from the fear and the concerns that my own health workers in my own hospital and health program have, and as well as other ideologically motivated organizations that I've worked with, there is a significant amount of fear, and which is justified fear, that they might have a risk to their own lives in the next weeks to come. And in that situation, the fact that that there is a looming risk of not having adequate protection when they will be forced to manage people has made almost a panic-like situation, which necessitates that personal protective equipment has to be there. Otherwise, there will be mass-scale desertion. Is my fear from both public and the private hospitals that we have in that country. And in this case, in the public system, this will be remarkable, where already we know that the level of accountability is still now questionable for many people who work in it. And if this protection is not there, this desertion, this abdication of one's clinical responsibilities would be far more, even at an individual level of health workers, which both include nurses, doctors, and other support staff.
So the key question is, do we have the resources right now to actually produce this, or do we need to import it at this point of time?
Well, I think there are problems at multiple levels. We are also, the fact that the procurement has been given to one public sector undertaking to procure from all the manufacturers has slowed down the process of procurement. But also manufacturing contracts being given out, tenders being floated, and people being asked to deliver those products. There has been a tardiness in that level also. At another level, we have to get some of these components of some of these protective equipment from abroad, if not the finished products, and that has to be worked on a war footing, something which is lacking. But I would add, there is another component to it. There is a lot of wastage of the personal protective equipment that is happening. I can see any number of politicians, bureaucrats, and police people and other people in the administration wearing protective equipment like N95 mask, which is not something that they need to wear at all. Those should only be kept for people who are health workers at various levels who are working with various levels of risks that they would have to take. So, as an example, I would say, why don't the state issue a strict guidance for people who are not health workers, not to be wasting and not to be demonstrating their power by using protective equipment that are only meant for the health workers. Otherwise, you're going to have a system crisis where people will stop working, is what my fear is. And if the situation becomes anywhere like Spain or what people see in England or elsewhere,
Right,
where protective equipment have been found in shorter supply than what was needed.
right. And then now the question of community transmission is still very much in the picture. The ICMR is still saying that we have not reached community transmission yet. The health ministry, on the other hand, in its latest document, actually said that there was something called limited community transmission, and we have seen cases across the country. In some instances, the number has risen quite significantly. So, how do you evaluate that situation right now?
Well, I think this the ICMR and the health ministry are being cussed about this idea. The fact that there is community transmission is probably not known only to these two organizations anywhere, and except them, everyone in this country believes that there is community transmission that is happening. Whenever they meant local transmission, when they when they confuse people with the words of opposing limited local versus community, as if the local are not community in this country,
Right.
Was an obfuscation that happened there, and I think community transmission is happening already. I would not even, I would now not engage in this debate about whether there is community transmission or not, because what was to be done once community transmission was accepted, was to go for a mass scale, testing, isolating, quarantining, and treating. And that is something that I would like to work on and exhort the various state governments to take that on at a war footing, rather than waste time in engaging with the people who would not like to admit their mistakes.
Right. And the other part is regarding quarantining itself. For instance, we saw that the kind of efforts China did when it came to quarantining, not only even the concept of centralized quarantining itself. So we talked about the issues healthcare workers have, but do hospitals in many parts of the countries, for instance, the areas where you're working in, actually have the facilities to put this kind of quarantining in place?
Well, I think this quarantining, frankly, the Prime Minister of the country thought that a lockdown is equal to quarantining the entire country, which actually it is not. Quarantine has a different meaning, and the only quarantining that I would approve of, which could have worked, was home quarantining. If we supported people to be quarantined in their own homes once they were symptomatic, and we provided social support for that period when those families were quarantining, or when a person was quarantining at home. When the numbers increase, that they would, that as is strongly predicted now, and as I would agree with, over the next weeks, we would not be able to admit people with mild symptoms in hospitals, and we would need to do some sort of arrangements where either they are quarantined at home or in some other place, if the numbers are larger, in their own mohallas or their villages, where we provide all social support and monitor them for worsening of symptoms, and they remain at home during that period. I would call it isolation rather than quarantining. And quarantining is when you're not sick also, and you're asked to remain at home or in a particular place. So I would say that we need to work on ahead of the virus and ahead of times, to plan where we can isolate people in their own homes, provide them social support, or in their own villages and their hamlets, rather than think about hospitals as quarantining or isolating places.
Right.
Since you would not be able to handle those numbers, and certainly you cannot isolate or quarantine entire cities, as was thought about by one of the world leaders for their own biggest city of their own country.
Right. Thank you so much, Dr. Yogesh, for talking to us.
Wow, Krishan, thanks.